Welcome to Chai Chat and Community, the podcast where we bring real conversations, one cup of chai at a time. I'm Saleha, and today on World Cancer Day, we are talking about something that affects women everywhere: breast cancer and cervical cancer. Many of us come from cultures where these topics aren't openly discussed, but knowledge saves lives. Knowledge is power. So let's break the silence, ask questions that matter, and empower our sisters, our mothers, our aunts, our daughters, and our girlfriends. Joining me today is my very special guest, Dr. Preeti Killan, an obstetrics and gynecologist who will help us understand what every woman needs to know. Thank you for joining me, Preeti. Always, always.
Thanks a lot, Sahilia, for giving me this opportunity. And yes, 4th of February is World Cancer Day, so very important and vital that we discuss, things which are preventable.
Yes, it is. Um, so let's start with breast cancer first. So we just want to understand the basics. What exactly is breast cancer in simple words, keeping in mind our very multicultural audience?
Yeah. So breast cancer is abnormal growth of cells in the breast, in the ducts or lobules.
Yeah.
And this is an uncontrolled growth of cells like any other cancer, which then changes into fulminant or overt cancer. So, yes, it starts with abnormal, uncontrolled growth of cells in the breast.
Okay. And how common is breast cancer? Because we kind of think, it's we are never going to get affected because of the color of the skin, because of wherever we haven't heard enough of it, but it is quite prevalent. And why is early detection so important?
Mm. So in Australia, because we're all living here, one
Yes.
in eight women develop breast cancer by the age of 85. So you can imagine how common is breast cancer. It's the commonest cancer for in women in Australia. So the prevalence is really very high. Hence, I think it is very important to talk about what can we do to prevent this? What can we do so that the cancer doesn't develop into late stages? And I think that's why we are all here today to just give a knowledge to everyone.
And bring awareness, yes.
Yes, and bring awareness. Yeah.
So, when should a woman start getting checked for breast cancer or mammograms?
So look, in Australia, our regular screening starts from the age of 50.
Yep.
So from the age of 50 to 74, which is sort of a cutoff, after which it is a woman's wish and desire if she wants to get screened. Women get regular invites from the government to go and get breast screening mammograms every 2 years. However, having said that, women between the age of 40 and 49 can still have regular breast screenings, which can be done free, but they would not get an invite from the
Yep.
government. But you look, it's very important. I think as soon as I see my patients, if they are 40, my first question is, have you had a mammogram or a breast screen? And many of them are not aware of that.
Yep.
We know that in Victoria we have breast screen clinics. All you
Yes.
have to do is they are busy clinics. You can imagine, the number of women coming for mammograms and screening. All they have to do is book an appointment and go there and get screened. Yeah. So
So
this is
what
one. Yeah.
yeah, no, sorry, Preeti.
This is community screening, right? But
Yes.
what can we do within ourselves, or how do we check our breasts? Look, I think it's very important for women to be taught for self-checking their breasts. So, there are various ways, raise your arm and just put your one hand up and start palpating your breast. Just feel the whole surface of the breast and then, go even up to your armpits. We
Yep.
say that women should be checking their breasts themselves regularly, even once a month, and they can do it according to their cycles. And if not confident, they can go to their GPs or the primary health providers to get regular breast checks.
So, Preeti, we are talking about women. Once you hit 50, the government invites you. 40 to 49, you can go and do it.
Yeah.
Does breast cancer affect younger women, say 18 to
Yes,
39? Does
yes,
it?
it can affect any age. And of course, I mean, there are various factors which, are contributory to breast
Yes.
cancer. And I'll talk about that. But yes, younger women can be affected as well. And sometimes, there's a genetic predisposition.
Yeah.
It
That's
runs
what
in
I wanted to
families.
know. Yeah.
Yes. So some women who unfortunately are carriers of BRCA1, BRCA2 genes, they have a higher incidence of breast cancer, and that can affect early as well.
So, in our cultures, we are very embarrassed to go and get a breast screening done.
Mm.
So, what would you say to them? How would you reassure them?
So I will say that, to all women that look, I know that, the way we have been brought up and, the way it was back home that we did not talk about, about breast screening or any of the genital, tract, problems or screening. Very important to have an open mind to discuss this. And I think it starts from the family.
Yeah.
Women have to be comfortable in their own family to talk openly about their problems. And I then just give this that their partners should be encouraging them to talk about their problems openly to them. So there's no harm in talking about your body, about any changes you're experiencing, anything which you think is not right. That is the first time, you talk to your family members. And then comes, other venues like you go to your primary healthcare providers, talk to nurses. And this is how I think we should bring. So those cultural barriers have to be broken. You're absolutely
Yes.
right.
So, I mean, I'm especially thinking of communities where, they will not, and I think one of the things that we should tell our audience is that everyone who's checking for breast cancer, the clinics are manned by women, so they can be rest assured, isn't it?
Yes, so look, I
Yes,
mean, gender concordant healthcare providers is one thing which has to be taken into consideration, but I say that we just have to get over that inhibition that,
I
it
know,
does not matter whether it's a male or a female. But
because they're
yes,
all, yep.
but we are very good in this country, preferences of gender are taken into account, even in hospitals. So if you want a female doctor, sometimes, I mean, if women are having procedures, they want female staff, then we try to arrange the theaters in such a way that they get all female staff. So that is
But it's
taken
not
into
possible
account.
all the time.
Yes, that's true. It's not
Yeah.
possible all the time. Yeah.
So we're talking about risk and
Yeah.
prevention. So you talked about it can be genetic. So what are some of the things that can increase the risk of breast cancer?
Right. So as I said, age is one of the things. As we grow older, the risk of incidence of breast cancer increases. Then there are other factors as nulliparity. If you haven't had children at all, or if the age of your first child is quite, if you've had your first child at an advanced age, early menarche, that is early onset of periods, those women, or if they have menopause later, these are some of the risk factors which increase the incidence of breast cancer. Then there are
Preeti,
other.
I have a question here before I forget. So, in today's day and age, women are having children later. It's not like my generation, where if you were 24, 25 and you didn't have a child, you were very old. Things have changed a lot for our children. Um, so when you say having children late, what is late? What and when you say don't have if you have menopause late, what is late menopause? What we're talking age, and again, keeping in mind that circumstances are different, lifestyle is different. Um, our children are not like us; they don't want to have children unless they are settled and when they can afford it.
Mm. Yeah,
So
look, late, as we say that, advanced maternal age now is 35. So, if you are over 35 and you're having your first child over, first pregnancy at the age of 35 or over, that is advanced maternal age. And early menarche is, when you get your periods very early. Some young girls get their periods at the age of 9, 10, or 11. And late
isn't that
onset.
normal now? No?
Look, I mean, it is normal to some extent, but before
Yep.
9, it is considered to be, it
Okay.
has to be investigated.
Sure.
And late menopause, now again, menopause varies according to, where we come from.
Yep.
Because if you look at Southeast Asian women, Indian women, for example, menopause usually is around late 40s, right? But in a Caucasian woman, menopause, the onset is usually around 52 is supposed to be the average age. So the reason for that early menarche and late menopause is that then women have prolonged periods of exposure to the estrogen in the body, and that
Yep.
is one of the, scientific reasons why they are more prone to have breast cancer. But look, these are the things which are not preventable, and no, these are the things which are not in our control. And that is when the importance comes of early recognition of signs of breast cancer or going on to early screening.
Yeah, and as you said, and it's as simple as just feeling your breast, touching your body, lifting your armpit, and these you can do anytime in the comfort of your home.
Yes, of course. And
Yeah,
I say that when you are in your shower, you can do it like you can time it according to your periods,
yes.
cyclical, before your periods or after your periods. If you just make that a routine, that really helps, because some of those symptoms of breast cancer can be recognized early.
Thank you. So, our simple lifestyle habits that do you have any suggestions for simple lifestyle habits that can help lower the risk?
Yes, so there is, of course, as we said, that obesity, your body
Yes.
weight is under your control to some extent, and that has, increased body weight has a relation, strong relation to breast cancer. Then the other is lifestyle, limitation of physical activity, sedentary life predisposes women more to breast cancer. So it's very important, I think, after a certain age to have that active lifestyle, some sort of regular exercise, as we've already, we've talked about this in the past as well.
Yes.
Very important, three times a week, whatever exercise you can, do easily. Then
Simple things like walking.
yes, simple things like walking, swimming, whatever,
Yeah.
is in your comfort zone and whatever you can do. And the other thing is also, avoidance of alcohol. Too much of alcohol also is one of the factors which has a link with breast cancer. Then eating a lot of processed meat, fried foods. Again, it all comes to healthy
Healthy.
lifestyle,
Yeah.
healthy eating habits.
So, my favorite all the time, cultural barriers. Because, yes, despite living in Australia, many women from different cultures, multicultural backgrounds, don't talk openly about their bodies. So, how would you suggest, as a medical professional, that we break these barriers and encourage conversations, have gentle conversations, encouraging women to go and get themselves checked? So, because I see no matter how much we talked about, you and I have talked about breast cancer before, and yet we don't see women going and getting themselves checked.
Mm. I think again, as I said, this starts from home. So, having those easy conversations at home is very important. Women have to prioritize themselves as well. Often women put their families over themselves.
Yeah.
That is the commonest problem, I think, in our culture. And that is a disadvantage for women. Then, running campaigns. And that's why we have a Healthcare Awareness Society of Australia, where we try to deliver culturally sensitive, healthcare advices. And then it's important for women that look, you find a GP or a primary healthcare provider who's comfortable and maybe speaks your native language, right? And these are the things, and educational campaigns, these are all the things I think. But I think the first thing comes starting from home. Women have to be they have to feel important. Look, they are very important, members of the family. Women are the pivot of the family, right? So they have to first think about themselves, take care of their own health, and that's when you can look after your family.
Absolutely. Absolutely. So, yeah, how can we get our partners, our boyfriends, our brothers, our fathers to encourage the women in our family to go and get screened? And, keeping in mind the cultural barriers that we go through, or many women go through, where, talking about bodies is not a comfortable thing,
No, it's not.
especially with a man.
Mm. Look, I think that we have to create that awareness more among men as well, rather than only women, because,
Yes,
if men are aware, then they will, guide whether it's their mom or their sister or their, wives, partners, to just take the right advice at the right time. So I think, we just need to have large campaigns and, we need to talk about this openly, even in such forums where we can encourage, a public audience is important,
yes,
that includes men and women. This is not only for women. This chat is for everyone.
yes.
And the thing, as I said, the first thing comes from the family. Women has to feel comfortable to voice her problems and talk about herself. And then comes secondary is take advice, at the right time.
Absolutely. Thank you. We come to the next important topic, which is cervical cancer. So, again, what is cervical cancer and how does it develop?
So again, cervical cancer is like any other cancer. It's abnormal, uncontrolled growth of cells in the lining of the cervix. And cervix, as we know, it is the neck of the womb, right? That is the the organ which is such an important organ which dilates in labor. And if a woman has vaginal delivery, that's where the baby comes out from.
Yeah.
So abnormal, uncontrolled growth of cells. And the most important cause of cervical cancer today is the HPV virus, which is called the human papilloma virus. More than 95% of cervical cancers are caused by the HPV virus. And that's the importance of all the screening and the vaccinations which prevail in today's world.
So, and is it preventable?
Right, it is preventable because, as I said, most of the cervical cancers are because of the HPV virus. So we can prevent it by vaccination and screening at the right time, right? So if we start with cervical screening in Australia, cervical screening is offered to all sexually active women from the age of 25 to 74, right? Often this question is asked that if a woman has never been sexually active, does she need screening?
Yeah, I
In
was going to ask
Australia,
you that.
yes, in Australia, our guidelines say that she does not need screening, provided she's never been sexually active. In other
What
countries,
would you suggest?
look, if she's never been sexually active, I would abide by the guidelines. But look, if the sexual activity has been even once or, it has been to any certain extent, then it is advisable. But in Australia, we say that if a woman is sure that she's never had any contact, any
Yeah,
genital contact as well, she doesn't need screening. So it starts from the age of 25 to 74, and it used to be every 2 years when we used to call it pap smears.
yeah,
Now we call it the cervical screening test, and it is offered every 5 yearly to women.
yes.
But there are exceptions. If there are certain signs and symptoms where women can have early screening as well.
Okay. So, Preeti, you said 25 to 74 in Australia, and not only in Australia, around the world, there are many women who are sexually active before that age.
Yeah.
Do they need to get tested
Look, I mean,
and screened?
that's exactly the thing is that if they have, had multiple sexual partners or, have developed any sort of, other STDs, sexually transmitted diseases, then that is the time when we can offer them testing as well. And there are certain signs and symptoms, any abnormal bleeding, any excessive discharge from the vagina. These are all the signs and symptoms when if women present with these, they can even be screened before the age of 25. So this is just a routine, so that we have some protocol for all women, but of course there are exceptions to this.
Always, yes.
Yeah.
So, are there any early signs of cervical cancer that women should know about,
Yeah, so look,
other than what you just said?
yeah, so for cervical cancer, it's mostly any change in your menstrual bleeding. And one of the important symptoms is bleeding after sex. That is one of the important things.
Oh,
If it happens, really have to think about all sort of possibilities. Offensive vaginal discharge. This is one of the things, these are the main things. But the good thing about cervical cancer is there is a condition in which the precancerous cells of the cervix can be detected and they can be treated before changing into cervical cancer. So this is one of the advantages of screening. With the cervical screening test, we check for the HPV virus.
yes.
Now, HPV stands for human papilloma virus. This is a virus which is largely sexually transmitted, but even skin to skin contact, genital contact can make you positive for this virus.
So when you say it's transmitted, other than skin to skin, how is it? Is it transmitted during sex, or how is it transmitted?
Yes, so it is by sexual intercourse,
It is
but
by sexual
yeah,
intercourse.
what I mean is that even skin contact, genital contact can make you positive for this virus. It's a surface virus, right? It's like any other viral infection. So this is the thing that if a woman is tested for HPV and she's positive, that is the time when we do what we call the pap smear test, when we check for abnormal cells in the cervix. And the good thing with cervical cancer is that the precancerous cells, they have got a very simple and effective way of treatment. And if a
Okay.
woman is treated, then that prevents cervical cancer in the future.
Thank you. I wanted to ask, so again, what happens if a woman is in a same-sex relationship? Does she still need to get tested and still need to get test? Is it still transferable? Can it still be
Yes, look, it
transferred?
can still be transferable, because as I said, that any sort of sexual activity, even, if it had happened once in your life,
Yep.
that can, lead to transmission of HPV. So screening is very important. I think
No matter what kind of relationship you are
yes,
in.
you
Yep.
should have regular cervical screening. Yeah.
Fair enough. So we all feel embarrassed or uncomfortable talking about cervical health. How would you make these conversations easier? And how can I, as a layperson, make these conversations easier and explain to people who need to go for cervical testing? What are the words that we would use?
Look, I think, the main reasons why it is not spoken of course, it's that taboo or that shame, that shyness among women. The other thing is fear as well, It is fear. What if I'm detected with cancer? What? And women are also scared that is this test very painful? Is this very uncomfortable? Right? And then, of course, they would sometimes they're hesitant to see male doctors. That is one of the reasons as well. So I think again we can make it very easy by such conversations which we are we
Yeah,
are which is happening, and as long as many people hear that, it will make them feel much more comfortable that cervical screening is a very important, and it is such a thing that it can prevent and change one's life, because there is early detection before the stage of cervical cancer. So starting those conversations from home again, and look, it's very important. It can also be dinner table conversations, because if I have a daughter, I would like her to know what exactly is cervical health, what does cervical screening mean, and before that, we know that, we didn't talk about it, but the immunization, the vaccine.
I was going to ask you that.
Yes.
Yes,
So the
yes,
cervical vaccine, which is the HPV vaccine, that is the Gardasil, is being offered to all adolescent girls and boys
yes,
between the age of 12 and 13 in
yeah.
schools now.
In secondary schools, yes.
Yes, yeah, between 12 and 13, that is adolescent age. And just for women who do not know that if they have missed out on this, they can still go to their GPs and get this vaccine till the age of 25, 26.
Okay.
Right?
Before you can go and do a proper testing.
Yes, yeah. So you can
Yeah,
still go and get that vaccine even till the age of 26. And this vaccine covers for nine more most virulent strains of the HPV virus. But look, this is a virus which has got more than 100 strains. So often this question comes that, look, I've had the vaccine and how come I'm still positive?
yeah,
It's just because the vaccine has limitations still.
of
But
course.
they've tried to culture it and they've tried to make it preventable for the most virulent strains of cervical cancer.
I think so I wanted to know about the secondary school testing because I know my girls got it.
Yes, yes.
So, and educating men about cervical cancer, and again, talking to women, to their mothers, to their sisters, to their wives, to their partners,
Yeah.
is very, very important, isn't it? Which is not happening in our communities. We just don't talk. Anything to do with the body is something we will shut down immediately because the embarrassment, the shame, the cultural expectations, and what we've been brought up with.
And we are lucky to be in this country because
Yes.
you may not know, but Australia aims to eradicate cervical cancer by 2035. It's the first country in the world we would be with
So
our
less than 10 years.
yeah, so yeah, it is less than 10 years now. My God, it's 2026. So
Yeah.
with our effective cervical screening and with the vaccine. And there's one more thing I would really like to mention that, for women who are ashamed or who feel that, look, how would I do this test? Is it painful? We've started the self swab, that is the self
Yeah.
screening from 2022. And look, if women are not comfortable to go to their doctor and have a speculum inserted to get the smear, they can start with the self swab. That is a
Yep.
very good thing because that at least detects the HPV virus. And look, if they are positive for the virus, then it depends on whether they need to go for further testing.
Of course. So before we end today's very important conversation, what is the one message you want every woman listening to our podcast today to take away about both the breast cancer and cervical health?
I would just tell everyone that, look, being a woman myself, I really, I'm an advocate for women. I really want women to look after themselves. leave, all their shyness and taboos. We are in Australia. We've got a good screening system. We should all avail that, and that's what, we can all do that, look after ourselves, and then we look after our families. And as I
Absolutely.
said, that we should really aim to eradicate cervical cancer because, Salya, let me tell you, I've seen so many women dying with cervical cancer during my training days in India. That was more than 20 years ago. But, cervical cancer was one of the commonest things, and it was not detected till late because there was no screening technique.
Yes.
So,
And
really,
and we are so fortunate living in a country where this is all free, isn't it?
yes, it is all free. Yeah, you're absolutely right. So please take care of yourselves. These screenings are very important. And look, I know that we are still behind because of our cultural taboos and because of our mindset, but we really have to look after ourselves.
Absolutely. And as you know, in the olden days, we used to say health is wealth. It still holds good now.
It is absolutely true. And as we are growing older, every year reminds us that
Yeah.
health is wealth.
Yeah. And every day we are growing older.
Every day we are growing
Every
older.
day. Yeah. 1 day older, 1 month older, 1 year older. So,
Yeah.
yes. Thank you so much, Preeti, for joining me on Chai Chat and Community. I hope today's conversation helped you feel more informed and more confident about your health. And as Preeti said, as a woman, you're the pivot of the family and you hold the family together. So please do go and get yourself checked. Share this episode with the women in your life. Awareness is a gift that we can all pass on. Until next time, stay connected, stay curious, and take care of yourselves and each other.